Most of us have been taught that an analgesic protocol will not be effective unless we include an opioid in that protocol. And as time has gone by historically, and those of us who've been in practice for a fair amount of time, the doses of the opioids have changed and changed over time. Maximum doses that used to be very, very tiny now have become maximum doses that are threefold or tenfold higher than they were before. Our knowledge of opioid physiology has changed over time. And then, of course, there's the human abuse potential, which is becoming more and more of a problem over time. So it's important to realize that not every single analgesic protocol requires an opioid for it to actually be effective in patients. And there are many drug combinations. And when we're talking about chronic pain, drug combinations will treat chronic pain much better than a single dose of any drug. So what we're going to do now is to just talk about pain and then how to manage it, including non-opioid medications as the cornerstone of protocols. I'll talk a little bit about adding in veterinary preparations, and we do have some opioids available to us that are strictly veterinary preparations of that opioid, and those will always be available to us. They have less of an abuse potential for human abuse, and they're available to us all the time. So when others come and go in their availability, we should be able to have these all the time. So what is pain? Well, pain is an unpleasant sensation that comes from a part of the body. And it's in response to actual or potential tissue damage. So that potential tissue damage is when we anticipate that something will hurt, or it's that reflex that will take us away from something that's going to hurt. Touching the tip of a needle, we reflexively pull away. Pain is a very, very complex experience, and we understand very little about how complex pain really is. We say, oh, there's been a bunch of research and we're looking into it more, and it's really come to the forefront of managing patients because we know that chronic pain has detriment to our physiology. It compromises every one of our body systems because it can be completely overwhelming, and it diminishes the relationship between the human companion and their pet. And what we're really talking about when we're managing pain is actually restoring the relationship between the human companion and the pet, which is why we have our pets in the first place. That bond is mysterious. We don't understand it, and it can be stronger with our animal companion than with any person we know. And so what we're dealing with when we're treating pain, especially chronic pain, is that restoration of that functional relationship where both parties can increase the joy in their bond. So what's painful behavior in dogs? Well, we can look at them and say, oh, well, they have a furrowed brow, or they have tightness of the facial muscles of expression. So when we have furrowed brow, when we have tightness, now we all know what anxious facial expression looks like. We all know what tension in facial muscles looks like because we are programmed as human beings to be able to read faces, especially faces of other human beings. However, it's an intuitive skill that we have to look at faces and try to figure out what's going on. You all know if someone has a bad headache, even if you don't know that person, or someone is in a fair amount of pain. If you don't even know that person, you can tell that there's something wrong just based on their facial expression. Sometimes it's good when you walk through the door and see your other person with that facial expression. You can turn around and go because you know if they're angry at you, you can read that. If they're sad, you can read that and you'll stay. However, we've not really applied that to veterinary medicine until very recently. We can talk about hunched sitting posture, restlessness, circling, chewing, rubbing, licking at wounds, whimpering, or vocalization is very far down the pain scale. Dogs don't cry out in pain unless it's acute, sudden trauma that will surprise them, or there's incredible suffering going on. We won't see vocalization as part of the pain scale until pain is considered intractable and severe.